The thing I like best is just the ability to impact people, on a direct level. I mean, function, our ability to move and be active is what equates to life.
It's really just rewarding to see that transformation from being frustrated and disappointed and hurting to being oftentimes pain-free and back to doing the things that they love.
Knowing that I make a difference in people's lives is, I guess, the reason that we go into work every day. It's ultimately what we did all the work in school for. It's all kind of comes full circle, knowing that people depend on us to make sure that they get the proper care needed and that we can do that for them.
My name is Kevin Middlemist. I'm an orthopedic surgeon. I'm an osteopathic physician, so a DO. I work at JCMG Orthopaedics and Sports Medicine. So I do a wide variety of sports medicine injuries, ranging from rotator cuff injuries to ligament injuries to the knee, shoulder, hip. Specifically, I do a lot of rotator cuff surgery, ACL surgeries for athletes, and other conditions where people, ranging from high-level high school athletes all the way to your weekend warriors to, the aging population. So an average surgical day usually is between 4 and 6 cases surgery-wise. And then typically for me, as far as clinic goes, I typically see between 40 and 50 people in clinic, ranging from knees, shoulders, hips, different pathology. People have aches and pains. As far as the schooling it goes, obviously you have to go through high school, 4 years of college or some sort of collegiate degree, and then you got to go to 4 years of medical school. And then after that, you got to get accepted into a residency, which is for orthopedic surgery, it's 5 years in length. And then for me in particular, I did a subspecialty fellowship in sports medicine surgery, where I did advanced training in shoulder and knee surgery and then taking care of athletes at a high level. For me, I was fortunate enough to work with a professional baseball team in Cincinnati. That was a very cool experience that I'll get to cherish for the rest of my career. Advice as far as to specifically for my career path, I think number one, you've got to be highly motivated, because it's a long road. Be motivated, be committed, and then if it's what you want to do, set your mind to it. And if you really enjoy that aspect of it, it's a very rewarding career path.
I decided to become a nurse because, for one, my mom was a nurse and I grew up watching her take care of people. There's a lot of sacrifice involved, but she loved doing it. I watched her in action, taking care of people, and I knew immediately this is what I wanted to do, and I wouldn't be happy doing anything else. My specific duties here in orthopedics are seeing patients that need non-operative care and operative care. If they do not need operative care, there's a different level of care that they can get, medications, injections. We just make sure that the doctor's aware of what they need. And if there is surgery involved, then we assist in planning the surgery and making sure that everything is set up from beginning to end. Someone that's wanting to get into nursing, I would suggest that they, for one, do their research. You want to make sure that you're going to be going into the right field. You want to make sure that you are going into, LPNs have different responsibilities than RNs. So making sure that you're getting the right education at whichever school that you go to is really important. And you need to make sure that you have the passion for wanting to take care of people.
So I knew kind of like as I was about to go off to college that I was interested in the medical field. I didn't know exactly what I wanted to do. I was thinking, maybe PT, considered medical school. So I was kind of all over the board. And then I actually had a shoulder surgery when I was in college. And when I had the surgery, the surgeon that I went to see, he had a PA with him, and I got to interact with him and see what he did on a daily basis. And I'm like, that seems like a pretty cool job. And the more I looked into it, I figured out that was what I was really interested in doing and thought it'd be a perfect career path for me.
I think there's some key sentinel event that says, hey, I either had this experience with a doctor, that experience, and then it kind of goes, I really like doing that. And for me, as far as for orthopedics, it's such a hands-on experience. I like working with my hands. I like being able to treat patients and help people.
I decided to become a medical assistant because I'm really interested in a career path as a physician assistant. And I feel like this will help me gain more experience in the medical field and getting more patient care experience so that can better my application to go to PA school.
There are a number of different ways that you can gain patient care experience in order to prepare yourself for PA school, whether that be the MA program as working as a medical assistant. We have some awesome medical assistants here who do a great job for us and are able to take great care of our patients. People are able to be patient care techs. You can be an emergency medical technician in the ER. You can be a CNA. There's really countless ways you can get some patient care experience. And then once you have some experience, you apply for PA school, get interviewed, and then attend PA school, which is a master's program most of the time. There are a few doctorate programs out there. But I got my master's for PA, and it's usually somewhere between 2 and 3 years for PA school.
It's not uncommon for, people to become an MA or a scribe and then work in a medical field or office and then ultimately go to medical school and then beyond. And so it's certainly not an unrealistic expectation just because maybe coming out of college, you didn't get into med school or chose not to. It's not something that for the rest of your life, this isn't a possibility. I know people who've gone back to medical school at a later date and ultimately they were able to get into this field and were able to pursue and have successful careers.
To be a medical assistant, you actually don't have to have a degree. There is a certification certificate that you can have, but you don't have to have that. All you have to be is 18 with a high school certificate. So my job duties as a medical assistant entail rooming patients, really getting the background as to why they're there. I do a lot of the charting, do a lot of anticipating the physician's needs, drawing up injections, stuff like that. So the sports medicine part, we see a lot of athletes come through here. So to see them pull through an injury and to be able to get back to doing what they love to do and to see the doctors be able to do what they love to do as well and to help get the patients feeling better is super rewarding.
I decided to become an X-ray tech. Honestly, I didn't want to be like a bedside nurse, but I knew I wanted to help people and work in patient care. I help do MA work too, so I'll room patients and then we'll order the X-ray that the physician is wanting, and then we'll just take them back and obviously position them and cone it down to the certain area that the physician is wanting, and we'll shield and do all that. Some days patients come in here and they have no idea what's going on, and imaging is a big part of diagnosing what's going on. And so yeah, I do think that being an X-ray tech with orthopedics makes a big difference.
So kind of my role here is I'm able to evaluate patients. I can diagnose and treat. PAs are able to prescribe medications. We can administer injections, and that's my role. Kind of half of the time, and then the other half of the time is in the operating room. And I first assist in the operating room. So kind of what that entails is assisting the surgeon in any way that can be helpful, and most of the time PAs will be the ones who close the wounds at surgery, and so I really enjoy that. It's a great variety and a great part of my job to have that change being in clinic and also in the operating room. In order to become a PA, you need a bachelor's degree. You can get a degree in pretty much anything as long as you get the prerequisites required to go to PA school. And then generally speaking, PA schools either require or strongly prefer some form of patient care, healthcare experience. So for me, I was an EMT on the ambulance for several years before going to PA school. Orthopedics is really what I love and what works well for me. We get to see people with various musculoskeletal complaints, so it's really rewarding to be able to see that, somebody that's hurting and that's having trouble doing the things that they love to do, and be able to get them back to doing what they love. Knowing that I'm able to make a difference in people's lives is really a cool thing. That's not something that you get in every profession, and I really think that it's truly an honor to be able to have the responsibility of medically treating people. It makes me feel like I'm really making an impact on people's lives.